We are celebrating a big milestone here at Cooperman Barnabas Medical Center, 25 years of cardiac surgery. I'm your host, Jennifer Williams, and we are lucky enough to sit down with two of our incredible surgeons, Dr. Arash Salemi, Chairman of Cardiothoracic Surgery for RWJBarnabas Health Northern Region, and Vice Chair Frederic Sardari, who was here 25 years ago to help kick off the program. So if you have a question or comment for Dr. Salemi or Dr. Sardari, please leave us a comment below. And please help me welcome two A-listers, everybody. Dr. Sardari, Dr. Salemi, hi, thank you so much for being here.
Thanks for the time, Jennifer.
I know that I stalk you from time to time to get you to do these things, so I am beyond honored and proud to sit here with you today. So thank you both. You know, you're great team players, and I'm so excited. 25 years of cardiac surgery, that's amazing.
Long time.
It's a long time. So let's start. Dr. Sardari, this is a question for both of you. Why don't you tell us a little bit about the work you do here?
Sure. My name is Fred Sardari. I've been here, as you mentioned, 25 years from the very beginning of the program. My title is Vice Chairman of the Department of Cardiothoracic Surgery, but I'm focused on the practice at Cooperman Barnabas Medical Center. So as such, I do most of the open heart, sorry about that, cardiac
Live TV, everyone.
operations here, but I also have responsibilities for running the day-to-day activities of the program here at Cooperman, which means clinical responsibilities, administrative duties, as well as teaching and education of residents, fellows, nurses, staff, etc.
That's wonderful. And how about you, Dr. Salemi?
Yeah, I am the Assistant Chairman for Cardiac Surgery for the Northern Region. It encompasses 3 hospitals, obviously Cooperman Barnabas being one of them. I have the distinct pleasure of being able to work closely with people like Dr. Sardari, Fred, who's a fantastic doctor, surgeon, and friend. And I think we owe a lot of our successes here at Cooperman to his services over the past 25 years. You didn't start with that much gray hair, did you?
And much more.
We have the picture too. There is a picture of the first day. And so 25 years ago, you didn't perform the first surgery though, did you?
I did not. I did perform the second one.
Okay, the second one, all right. And so what does that mean to you to be part of to start from the ground up with the program, and it's still, being, at its best now and probably continuing to grow?
Well, it makes me very proud because I saw the program from the very beginning, which was a small cardiac surgery operation, a practice with limited scope. Developed over the years into what it is today, a full-fledged department with multiple specialties and expertise. And it's important, and it makes me proud to have been part of the development and have played a part in it.
And tell us kind of, on that first day 25 years ago, what did cardiac care look like?
As far as the quality, I think it was there from the start, but in terms of scope, it was much more different. We're really building from the ground up, so everybody had to be hired and trained. So it was a little, different, but very exciting.
Yeah. And Dr. Salemi, now 25 years later, how have we grown now, and where are we right now? What does it look like now?
Yeah, sure. I think one of the most incredible things about the 25 years sort of history here is that clearly the program was built, certainly with Fred's help and with many others' help, on a great foundation. And the mission and the vision were correct. And so when you have that combination, you can build something that's truly enduring. The program has always put patients first. There has been obviously innovation in our space. There's been an increase in the acuity of care of our patients. There have been, innovations in treatments, and fortunately, the program, the support staff, the administration has all really supported our ability to provide these services to our regional community. And so, as I see it now, I see it as really thriving program where patients receive the best care, in the state, certainly, and within the region. And it's in large part due to all the attention that was given early on to the underpinnings of how the program was built.
And to talk about a little those, some of those services, what services do we currently offer?
Yeah, I mean, the list is long. Adult cardiac surgery encompasses all types of, coronary artery bypass grafting. We treat all forms of valvular heart disease. So, we replace valves, we repair valves. We perform aortic surgery here, which is a very distinct subset of care. We do all types of reoperative surgery. That's certainly one of his many expertises in doing surgeries on patients who come back after having had their first surgery 20 or 25 years ago. We do structural heart procedures, minimally invasive procedures on the heart valves, and we do total arterial bypass grafting. The list is long. We're a full service unit here. So.
That's wonderful. And this question I want to ask to both of you. What would you say you're most proud of when you look at the service line as a whole?
Sure. Let's see, from my perspective, I think the care is exceptional. I think the services and the commitment is incredible. I think what I'm most proud of is how we're able to provide sort of patient-specific care. So we customize our care for each individual patient. Two people may come in with the same disease process, but they could end up with two completely pathways of care. And so we're not a one-size-fits-all. Our patients are not just numbers. We're really trying to get that treatment that's specific for the particular patient. And I think that's how we achieve the great results that we have.
And how about you, Dr. Sardari?
What makes me most proud really is two things. One is what Arash alluded to, is having developed into really a multi-specialty, full-fledged department. But more importantly, the reputation of excellence that we have here took years to develop, and that's not something you can have a shortcut to. It really, you have to work at it, and
you have to earn it.
You have to earn it, and that's very special.
Yeah. And the big question: where do you see us in the next 25 years?
Yeah. I mean, it's hard to imagine us here in 25 years, but I think
you laid the good foundation.
That's
though,
right.
The groundwork. Yeah.
I'll be curious to see what Fred says, but from my perspective, I think we're on an incredible trajectory, and we owe a lot to the institution for supporting sort of our mission of patient care. I'd like to see us continue to grow, to become a destination within the region, and nationally as we sort of carefully adopt the best care sort of services for our patients.
My vision is different. I see a condo on the river. I can relax.
I knew
look back.
You're watching it from afar. And you said, hey, I was a part of that.
But I'm sure I'll be still very proud of what it will be.
Absolutely. And this is a question I want to ask both of you. And I'm sure it's similar knowing both of you, but what does providing good cardiac care look like to you?
Do you want to say?
Sure. I mean, we've kind of alluded to that already, but there's two things to me. One is to be able to provide the latest, most technically advanced treatment, whether it's minimally invasive or a big operation, to have all that, the spectrum of all the available options available to the patient. But more importantly, individualized care. That to me is the balance between individualized care and advanced treatment is something that not all hospitals are able to achieve. You have to be the right size and the right mentality, and I think we've been able to achieve that.
We have, incredible team of specialists who are committed to the care of our patients, and really from top to bottom, you can't find a gap in any of the care. I think one of the things that separates us, is that there's a lot of compassion for our patients, when they come in at a time of their where they're the most vulnerable in their lives. And, it's easy again to sort of view the process as a factory or a revolving door sort of thing. But I think everyone here, once as a patient you enter our door, you're treated as though you're a member of a family, and there's that sympathy and empathy for what the patient is going through that makes the experience a heck of a lot better. So.
It is an amazing team. I do attest to that. And how important is it to have a plan for your heart?
Yeah, that's a great question. Unfortunately, issues related to the heart can arise at any moment. These can be acute events. And I think there's so much in preventative care that exists now. If you have a plan for how you want to address matters related to your heart, and you have a preventive strategy, whether it's, and we have an incredible team of specialists in cardiology and in primary care, then you can be proactive about the care of your cardiovascular system. And I think that's a very, very important part of good health. Yeah. And I think it's a great thing that we espouse here.
Yeah. And okay, last question. Your best elevator pitch about why people should come to CBMC, RWJBarnabas Health for their cardiac care.
You go first.
I think I'm repeating myself, but you're going to get the best individualized care and the latest advances in technology.
Mm-hmm.
Yeah, I mean, we have a team of really incredible caring people, and so the care is going to be very specialized and very dedicated to the individual patient. So.
All right. I'm going to let them go. They have surgeries to do and people to operate on, but thank you so much for being here.
Thanks so much, Jennifer.
Truly, thank you for being here. Congratulations, 25 years. That's amazing. And wherever you
right.
are in 25,
No cake, no nothing.
Listen,
Where's
it's not
the
official yet. The official celebration. Stay tuned, everybody. So we will see you. For more information about our cardiac services, please visit rwjbh.org/heart, and we will see you next time. Thanks again. Bye, everybody.
Thank you.